Hello, everyone. I am Alderman Will Stewart, and I'm here today with Adrienne Beloin, the city's new Director of Homeless Initiatives. And today we're going to be talking about homelessness, a very complex issue and perhaps the most pressing issue facing the city right now. Welcome, Adrienne.
Hi, welcome everyone.
So let's jump right in. Tell us a little bit about your background. You've been with the city a little more than a month now. What have been can you tell us, well, let me start again and say, can you talk about what kind of work that you've done in the past and what kind of successes you've seen as it relates to reducing homelessness?
Sure. So the work that I've done in the past has been, well, I'm a clinical social worker, so that's what I studied in graduate school. And in my internship experiences, I got really interested in homelessness right away. So I was working in an infectious disease clinic in Boston, and getting to know that particular vulnerable population got me really curious about serving vulnerable populations and moving more into kind of medical social work. And then as a young social worker, I worked in an emergency room setting, and I was a go-to social worker to kind of work on homelessness issues. So we had kind of, as part of the continuum of care, I was part of the services where folks are coming in with repeat injuries or alcohol related illnesses or alcohol related dementia. There were lots of different pieces that were happening in the medical setting that I was working with, and I was feeling a lot of limitation about what happens when they left the emergency room and the services and systems. And so I really, all that to say that I carved out a career path that sought to answer the questions that I had from my clinical service days of how best to serve these individuals and where there might be holes in the systems that serve them. So I went into housing advocacy, basically. So I worked kind of providing direct housing search, placement, and stabilization services to folks in the community setting that were homeless. And then from there, I worked in addiction settings, learning how to provide treatment to folks for addiction services that are homeless. I worked in community health care, kind of overseeing programming that was providing addiction and primary care that was integrated, and other mental health and primary care integrated services in a community health model, serving very vulnerable folks, including homeless folks. And then in my most recent position, I was overseeing the largest day shelter for homeless individuals in Massachusetts. And that day shelter was servicing 500 folks every day that were coming in for refuge services. So that's, the basics like clothing, food, showers, hygiene, spaces to sit down in, all those basics, all the way through rehabilitative programming. So we did workforce development where we trained folks to on life skills that would help them connect to jobs. We provided behavioral health intervention for mental health and addiction services. We did street outreach with folks. We connected them to housing supports. We had rapid rehousing and all kinds of housing supports. And then we provided permanent supportive housing as well. So it was kind of a full continuum of different services that hit on everything possible that you can do to kind of help folks kind of obtain stability in the areas they need to secure housing and move out of homelessness. So that's my background, and I very much identify with being a clinical social worker that is public health focused. And my mission in my life is to add value to finding solutions for folks moving out of homelessness.
Well, certainly, very glad that you're here in Manchester. And before we kind of, move on to Manchester proper, I'm curious what kind of successes, were you able to see, down in Boston in your work there as it relates to reducing homelessness?
Yeah, I mean, I was really lucky to be a part of a lot of innovative programming, and I really believe that that's the key to success with homelessness. I've always understood that you cannot really apply traditional models of care, the ones that we might enjoy, who are those of us that live in the housed population, non-traditional care and things that are innovative and trying new things is basically the way that you get to the heart of what works with homeless individuals. So I've been a part of lots of different programming where I've seen success happen. So I've been a part of lots of housing first programming where you're bringing people right from the streets into supportive housing and wrapping around stabilization services with them so that they can really rehabilitate, have the time they need to adjust and get back on their own feet so that they can sustain their own independence. So I've seen those successes. I've seen a lot of success with peer models. So using peers that are in recovery from substance use disorder, using peers that are in recovery from homelessness, to be the point people for folks to navigate the system and to have them do the outreach or be part of an outreach team where they work hand in hand with clinicians to really help folks feel connected to the service, ask the questions they need to in their own language, and have almost like a mentor who's been through it. And it provides people a lot of inspiration that they themselves can move out of homelessness or move through addiction services. So those are a couple examples of successes that I've experienced firsthand and seen a lot of people, move out of homelessness because of that.
Well, it's always definitely the ultimate goal. So you've been on the job here in Manchester for a little more than a month now. What have been your priorities in this short amount of time?
Well, obviously there's a lot of stuff going on in Manchester, and it's not unique to Manchester either. And so my priorities in this month have been as quickly as possible, try to get oriented to the system at the city and who we have in the other departments and learning about who my peers are in this setting, but also getting into the community to really find who my partners are going to be in the community. So I've done a lot of work to make sure that I'm at any of the collaborative meetings, and I'm sure there's many more that I still need to get to, so I can create some alliances there. But any of the collaborative meetings that are about folks coming together that service the homeless population. And some of this are kind of official folks that are part of the continuum of care that are funded to provide those services. And some of them are folks that are not part of the continuum of care and that aren't particularly funded that are also providing services and support to the homeless individuals. So I want to connect with those groups so that we can see how best to refine our system and create better ways of communicating and working together and determining what data we're using to kind of measure our outcomes and what training we're providing the on the ground staff so that we can kind of better collaborate and create a system that is more effective.
Yeah, and that's certainly what we all want to, an effective system, to help us solve these challenges, which you mentioned are not unique to Manchester. And I'm curious to hear your thoughts on how the situation here is similar to that in other cities and how, if at all, it might be different.
Well, I've only done this work in Boston. I'm glad that I have that experience in my belt because I think a lot of what we did in Boston was well funded, and it was probably leading in the country, amongst other places, leading in the country in some of the programming that was implemented. So I'm excited to kind of share my experiences that I went through in Boston doing this work, especially around encampments and low threshold solutions that help people recover from street homelessness. So I only have that experience and I don't have experiences in other communities. And I think that will be a big part of my job is to research that and to take a look at other cities that are more comparable to Manchester. I appreciate that Manchester is not Boston. And doesn't have Boston's resources. So there's going to be the right fit that I'm going to try to find for Manchester, and I'm going to be using a lot of other folks to help me determine that. I think our board of aldermen have a lot of opportunity to support me in looking at those items. We might be needing to create committees of the right people that are in the city and outside of the city in order to determine what those correct choices for Manchester are. And taking a look at those other communities and their successes and talking with them in consultation is going to be a big part of it.
For sure. So when it comes to responses to homelessness, it seems to me that we really need to address the immediate needs. I mean, you mentioned the encampments, that are most people, I think, have seen and, don't like to see. And I'm sure that people don't like to be living out on the street. So we have those immediate needs. And, while we also need to be working to prevent others from becoming homeless down the line, what, are kind of your thoughts on what needs to be done to both upstream and downstream to reduce and eventually eliminate homelessness here in Manchester?
Yeah, I don't want to lose sight of the immediate concerns and the long-term concerns that we have. So I think I'm going to try to have to balance that because I don't want to throw all the efforts into the urgency of the immediate and kind of forget that we've got, a streamline of folks moving into homelessness that we need to prevent, right? So the prevention side of things, I mean, I think it's affordable housing and it's, just creating opportunities for folks that are manageable so that they don't fall into homelessness. I think that when folks fall into homelessness, they are then more vulnerable to have other types of stressors come into their life after they've suffered a traumatic event like falling into homelessness. So I think that from that moment, things tend to get more difficult for folks and they potentially have more complicated issues that need to have intervention. So prevention is a huge part of that. So creating affordable housing, creating a portfolio of affordable housing that includes deeply subsidized housing, extremely low income housing that's available for folks. And creating lots of different types of housing that work for folks. Sometimes congregate style housing where you share some community space like a kitchen. Sometimes that's of benefit to certain types of folks that level of living is more supportive to them than having complete independence in an apartment, for example. So I think we need to have a variety of opportunities that are affordable to folks at a variety of incomes. So that's the housing part of it. I talked a little bit about the improvement of our existing system, and that's another piece of it. Where do we have gaps in our service models? Where can we improve? Are we really looking at this from a data-driven standpoint and determining as a city where we're putting our efforts into and how they're doing, right? So that's a big piece of it. And then there's the response to the current suffering that's happening, and that's the most visible part of that. There's a lot of suffering happening. Some of it's not so visible and it doesn't get as much of attention, right? And maybe I need to bring more attention to those invisible pieces of suffering, but the visible pieces of suffering do get a lot of attention. And that is a big piece that we need to respond to as well. And the way that I see us responding to that is trying to determine the services that do not exist at this time for the population that's suffering on the street and determining what it is that will work for them, that will move them forward. I have a lot of experience with seeing models work for folks that are living in encampments and seeing them leave encampments and move into housing and do well. So there's opportunities there that I don't think we've been able to explore yet as a city. And I hope to kind of bring that to the table. And the other thing is reducing the stigma around homelessness and addiction, because reducing the stigma and helping the community feel more educated around what happens with homelessness and addiction, it may lend itself to more solutions about how we best integrate with this community, this part of our community. These are our neighbors. Even if we make huge strides in impacting homelessness and reducing the amount of folks that are suffering with homelessness, homelessness will still be an urban issue that Manchester deals with. And if we incorporate programming that really embraces the population in a positive way, that's going to be a part of the puzzle that keeps this thriving in a good way.
So you've mentioned a number of solutions and potential solutions, upstream and downstream. What would you say, are the biggest impediments at present to implementing these solutions here in Manchester? What's needed that hasn't yet happened?
Well, I will just give an example because I don't want everyone to feel like any one example means it's the only solution that needs to be provided. It's a complicated issue and it's going to take a lot of different pieces of approaches. But one big example is individuals that are living in encampments have many barriers to being able to access emergency shelter. One of the biggest barriers we have is we don't have enough emergency shelter to offer them. But what we know is also true is even if we had more emergency shelter to offer them, there's many of them that would not work for. So that's a really good example of there's a key model that we're not offering people that is lower threshold for people to step over than emergency shelter. And I experienced that in Boston. We had open beds in Boston and we couldn't get people to come into them. And that was very difficult for the community to accept. And I understand that as well. And I think that there's an opportunity to educate folks around what the direct service providers in the city already understand very well, which is there's a high level of substance use disorder and trauma and mental health issues that are not stable for folks living in situations like street homelessness. And we cannot provide intervention for those types of issues while they're living in a tent on a sidewalk. It's not an opportunity where an outreach worker can make connections. And I do know they make connections all the time and they get people connected to things. But for everyone who's out there, we need to provide a different environment that is safer, more comfortable, and healthier for them to even engage in with service providers on accessing that next level up care.
We'll certainly look forward to hearing more about that as you continue on in this role and you'll continue to bring forth and have these conversations. You mentioned, service providers. You've talked about, other city departments, about other levels of government. You're kind of working together. Yesterday, had a meeting with downtown business owners and property owners. It's going to take all of us, as I think you kind of mentioned and alluded to. And on that, as we wrap up, I'm curious to hear any advice or requests that you might have for us as individuals, who are housed. What can we do as individuals or as organizations we might be a part of, who want to help? What can individuals do?
Yeah. I mean, I'm okay with this becoming my tagline because I have said it a few times, but my impression of Manchester is I'm really impressed with people's willingness to want to help. And you can imagine as the director of homelessness initiatives, I get a fair amount of calls and concerns from the community brought my way. And I have to say that I have not had one brought my way that wasn't reasonable, that I didn't appreciate, and that didn't come with an offer to help in some way. I also think that this community really cares about the community, and that can really be leveraged. And there's a lot of talent that I see on our board. There's a lot of talent that I see within our internal departments at the city, and a lot of talent, amongst the homeless population, honestly, and amongst the community that's concerned about this. And I think that we can leverage people's resources, their ideas, their ability to research ideas with me, their unique solutions to things, ways to engage homeless individuals and productive engagement. There's lots of opportunities where we can kind of turn this situation around and, create the change that we all desperately want to create.
Well, I'm glad to hear that you've met with a lot of offers to help, and certainly if there as specifics might come up. I know one of the things you mentioned yesterday was we need people to really help in a lot of these programs. I saw Waypoint, for example, looking for folks to pull a shift every now and again at the youth overnight shelter. And a lot of it, we can stand these things up. We can fund programs, emergency shelter beds and so forth. But if there's no one there to do the work, it makes it incredibly challenging.
Yes. Yep. We need people. We need people. We need locations that we can use to put programming into, and we need people to provide services to it. And we need all different types of people. I appreciate also the donations that there are a lot of people in the community very eager to provide donations to the encampments. That was another opportunity that I think I'd like to help coordinate differently so that we can actually provide the right types of items at the right time, at the right locations, so that, you know, it makes the most meaning to the effort people are putting into donating. So.
Right, absolutely. And, I'd say, whenever, this, any specific plans or asks in this regard or others come up, excuse me, please feel free to reach out. We'd be happy to share with, the viewers of this video and others across the city who, I think a lot of people are just waiting to be asked, and don't know how to help, but would like to, if they had a specific way to do it. So, Adrienne Beloin, thank you for joining us here today to talk about, again, this very complex, complicated, and pressing challenge facing the city right now.
Thanks, Will. Happy to do it.